Okay, so just a few words on nasal obstruction. Nasal obstruction is one of those kind of quiet problems a lot of people deal with. They can't breathe through the nose. So sometimes it's, it happens to me only when I'm sick. For other people, it happens to them every night. We've all had that experience that when you lay down in bed on one side, this side fills up. You turn over to the other one, this side fills up. And that basically is just the blood. When you lay down on one side, all your blood wants to be towards the bottom. It tends to cause those turbinates to become engorged, and you can't breathe through that side of your nose. The problem becomes when people can't breathe and it's interfering with their sleeping at night, so either snoring, sometimes it's sleep apnea, it's other kind of chronic conditions that are brought about by the fact that they can't breathe well through the nose. We especially see it in males if they're using any kind of erectile dysfunction medication, Viagra, Cialis, those kind of things will cause the nasal cavity to be obstructed, so it's not uncommon that we have older males that kind of have difficulty breathing through the nose. It interferes with breathing, for those of our patients that wear CPAPs, sometimes they're wearing the mask and the mask is putting pressure in the nose, but because their nasal cavity is obstructed, the air is still not making it in there. And so decreasing the size of the turbinates is a really easy thing that we do. It's not even the balloon sinuplasty. It's easier than all that. It's cheaper than all that. It takes me about 5 to 10 minutes to do in the office and really drastically improve people's nasal airflow. So it's one of those kind of quiet things that a lot of people suffer from, that probably take medication. They take decongestants. They spray Afrin in their nose. They take, all these different medicines to try to make it better. The medicines don't work. That's where I come in. So, if there are any patients that are out there that are listening to this discussion, they think, oh my gosh, I have all that stuff, come in and see me. It takes me 10 minutes to do a turbinate reduction in the office under local, and, you won't need all those medications. So it's easier than pulling a tooth or, anything like that. It's just a very simple office-based procedure. So yeah, that's one of the things I think, it's just even a public service to let people know that exists. A lot of people don't know, they're going to they're buying the 3-way nasal spray or the Afrin or, whatever, whatever it's called today. They always change the names of those, but those things, we can make that go away, those medicines.